sick leaves we've talked about in the past, and there's some super important nuances that I wanted to make sure we got out to everybody and went over, because it is not like the ones we've done in the past. And the new one is under California, and so we know California is super difficult in their enforcement and unforgiving. Remember, this is just providing you with general information about these new laws, and if there's nothing going to be provided that's specific to your situation. So if you have questions that are very particular to your organization, you want to make sure you reach out to your labor and employment attorney and get those questions answered. This will just be general information for fun purposes, right? This topic also, I will warn you, sort of builds on itself. So we're going to cover the laws, and then we're going to cover some frequently asked questions. And then I threw in a surprise section for you on the end about a new COBRA law that nobody's talking about. And it makes me nervous because part of it does start today. So we're going to cover that to make you aware of those major changes as well, so you don't get caught up in that little talked about but very important change for COBRA folks. So under the California law, as some of you know, Governor Newsom signed a new supplemental paid sick leave. Not a huge surprise, but it is in some respects, not, things we couldn't have guessed were going to be in this law are there. It was effective earlier this week on March 29th. And it's going to be retroactive to January 1st, and it's going to end on September 30th of this year. So it is going to be retroactive to January 1st, but don't sweat the retroactive portion. I'm going to talk to you about how we cover that. It's probably easier than we thought it was going to be. So don't sweat that. This is going to provide up to 80 hours of COVID-19 related paid sick leave for all of our employees if you have 25 or more employees. So that's 25 or more employees, no matter how big you are. So there's no 500 person cap here. And unlike the last California one that started at 500 and went up, this one goes all the way down. So if you have basically 26 or more, you're going to be covered under this new law, and it started earlier this week. So, and we'll go over the retroactive requirements. So this new law is a little bit different. It does cover quarantines or isolation orders. So this is not a self-isolation. This is not saying, well, I've been exposed, I'm going to take myself out. They actually have to be put out by a medical provider or the public health department. And sometimes when we know somebody should be put on quarantine but hasn't, we'll help them out by saying, you know what, let's talk to public health, let's talk to your medical provider. They'll put you out so that you then qualify for paid sick leave. So you can't put yourself out. The covered employee, first and foremost, has to be unable to work or telework. So if they're still able to work remotely at home, this is not going to apply to them. They also have to be, another availability is that they're experiencing COVID-19 symptoms and seeking a medical diagnosis. So again, we had a lot of folks last time who said, you know what, I'm sick, but I'm not going to a doctor. They wouldn't qualify. And how we know this is because it's what they tell us, right? They're outing themselves, not realizing there's a nuance in this law that they actually have to be seeking a medical diagnosis for themselves. They can also be caring for a family member. So this isn't just your neighbor or anybody, it's a family member who is subject to a quarantine or isolation order, or if their child has a school or a place of care, like a daycare, that's closed or unavailable because of COVID-19 on the premises. So it's not somebody who's chosen, to put their kids in a remote working, learning environment. That doesn't apply. It's if their school gets closed because of COVID-19 on the premises. So what we've seen so far, if your kid has somebody in class who comes in and has COVID-19, they're going to go ahead and quarantine that classroom, and those kids have to come out of school, which puts you potentially having to take care of them at home for 2 weeks. That would be a covered reason under this new plan. So if they just temporarily get put out because of COVID-19 on the premises, and in some cases we've seen entire grades or schools have to close temporarily to quarantine, that's going to give them up to 80 hours of paid time off. The new one that we actually like is vaccine related reasons. So if an employee is attending a vaccine appointment or can't work because they have vaccine related symptoms, so if they have a reaction to the vaccine, they could get potentially up to 80 hours of time. So that one's great because it helps encourage folks to go get vaccinated and not have to worry about, if they have a reaction, not being able to work. Then this will cover them for that so they can feel comfortable and going and getting a vaccine. Because I know that has been a worry for some of our workers, that they wouldn't have paid time off if they get the vaccine and have a reaction to it. So this will cover them. And usually that time off is just a day or two at the most. So it provides them with payment. So the paid leave for covered employees is 80 hours if they're considered full-time. So even, and this starts on day one of employment. So if you hire somebody full-time, or they're going to be working at least 40 hours a week is the expectation, I would go ahead and consider them full-time, and you would grant them 80 hours or up to 80 hours of COVID paid sick leave. If they're part-time and they have a set schedule, so you have maybe somebody in the office, they normally work 20 hours a week, then you're going to grant them 40 hours of time, right? So if they're part-time, they're regularly scheduled, you grant them the amount of time they're normally scheduled to work. And the last option is part-time with a variable schedule. So they're going to get 14 times the average number of hours worked per day over the last 6 months. And I'll break that down for you a little bit further for variable schedule employees. Now, if they're generally full-time, I would err on the side of calling them full-time, even though maybe there's some days they work 6 hours instead of 8.5. We always when California law comes into play, you always err on the side of caution of over granting rather than under granting. One of the biggest changes to this law that I want to point out to you and make sure you're aware of is the amount of pay we have to give our employees. In agriculture, we pay all different kinds of rates for all different kinds of things. So we don't have, like a typical office worker, it's a set salary, a set amount of pay per hour, not, that's easy. That's what they're going to get paid, right? Their regular rate is what they're going to get paid. This law says, look, you've got to pay the highest of 4 categories of pay, the highest. So, and that's when the leave goes to be taken. You're going to pay that highest amount on that day that the leave is taken. So it's the regular rate of pay for the work week in which the leave is taken. I would calculate that out like you calculate overtime. It's possible that they don't calculate it like overtime, that they don't include certain types of pay, but until we get that clarity, remember, overpay good, underpay bad. I would err on the side of that. So calculate it, that weighted average, to see what the regular rate is until we're told otherwise, or the state minimum wage or the local minimum wage. Or, and here's the big one that I think is horrible to try and calculate, the average hourly pay for the preceding 90 days, not including overtime pay. And you figure out which of those is the highest. So unlike California paid sick leave, where I can do the regular rate or I can do the 90 days, here it has to be the highest. And I know some of your payroll software companies have already come out and said, yeah, we're not going to be able to do this. So you definitely want to check with them and make sure that this is COVID-19 supplemental paid sick leave compliant. And then I would double check them the first couple of times it goes to be run, because what we find is they do not promise you that they're providing compliance. They're like, we just do what you tell us to do, and if you read contract, they don't promise to be compliant. So watch out for that. If you have an exempt employee, so somebody whose salary, you would take their salary, their annual salary, divide it by 52 weeks in the year, and then divide that by 40 hours, no matter how much time they work. So if they're on salary, and let's say they normally work 60 hours a week, you still divide it by 40 hours, and that's going to give you their rate of pay. There is a cap on the California supplemental paid sick leave, and it's a maximum $511 per day and $5,110 in total over those 80 hours. So that's the cap that you have to pay. There is a poster requirement here. So a lot of folks are asking, what notice do I have to give to my employees? You've got to put up this poster, and I provide the link here. Put up the poster in a conspicuous place. And a lot of you ask, can I throw it into my supervisor notebook? And I would say, maybe if you've got that supervisor notebook out and available for employees, such as under the shade tent, right? Where you put your HIPP, your heat illness, your IIPP, your COVID plan, all that stuff has to be out and available to them. Otherwise, get it posted up, maybe by the bathrooms. If your employees are working remotely, so if you have some office workers who are remote, go ahead and email them a copy of that supplemental paid sick leave poster, so that you've now complied with the notice requirement. So, like all things in California, I've got to layer the California paid sick leave with federal law, right? So we also have coming into play today, starting what's called the Federal American Rescue Plan. So this is building on, we had Ffcra pay that ended and was mandatory through December 31st of 2021. And then it came under another plan that was voluntary to extend it through March 31st, so yesterday. This is going to continue to be voluntary, but it's starting anew today. So before, if they hadn't used up their time, they could continue to receive that through March 31st if you opted into the program. And that wasn't anything formal. You just had to decide, yes, we're going to continue paying it. Now it's going to be voluntary again, but they're going to renew that time. So they're upping it again. That starts today, and it's going to last through September 30th. Now, here's the big caveat, though. It's for private employers with less than 500 employees. So if you're a large employer, you're not going to get to take advantage of this plan, and it goes all the way, zero up to 499 employees is going to be available to you to get your payroll tax credits. And I'll work through those in a little bit, how that sort of slices through layering those two laws together. As a reminder, under the new American Rescue Plan, we've got all the reasons we had before to take paid sick leave. So if you were placed on quarantine by a healthcare provider, if you were placed on quarantine by the government, public health, you could take it. If the person was experiencing symptoms and seeking a medical diagnosis, you could take it. If they were caring for someone, so this is broader, not a family member, but anybody who was subject to an isolation order, they could take it. So a little bit broader there. If the employee was caring for a son or daughter whose school had been closed or their child care provider was unavailable, they could take it. And the school closure, again, you couldn't be opting into remote learning. If the school was available and open, then that's what you had to do. but let's say they had an outbreak, you could take it then. The changes to the American Rescue Plan thankfully adds a couple of new important reasons. One, obtaining a vaccine. Yay. So we've got a match there with California. Recovering from an illness or condition related to the vaccine. So if you have a reaction, maybe you don't feel good for a day or two following your vaccine, you could take some time off, and the employee's you're gonna get a tax credit back for paying them. So it's a win for both of us. Or, and this is a really great portion here, I love this one, seeking or awaiting the results of a COVID-19 diagnosis or test if the employee had been exposed to COVID-19 or the employer requested the test or diagnosis. So here, think of Cal OSHA's emergency temporary standards. If we have to put employees out of the workplace, that exclusion rule, this could kick in to pay the employee for that time. Or in a lot of cases, we had folks who'd been exposed to COVID-19 through someone close to them or living with them, and we wanted to put them out because we knew it was the best thing to do because they had such a high probability of coming down with it. This would provide them that time paid. Previously, that had been unpaid. So between the two, this is a great addition for us for giving pay to those folks so that they aren't afraid to tell us if they've been exposed to COVID-19. And if we have to put them out under the exclusion rule, if you're under 500 employees, now you could get tax credits back for that. So that's super helpful. Now, remember, under the federal plan, we've got paid sick leave is one side of it, and then we've got paid family leave is another side of it. So California doesn't touch this family leave portion. So this is just purely federal family leave. And before it was 10 weeks, although they could use the first 2 weeks of paid sick leave, and then the second 10 was going to be paid family leave. Now they've changed that so that it's a pure 12 weeks. And so it eliminates the requirement that the first two be unpaid, although we were using paid sick leave to cover it. It is paid at 2/3 of the employee's daily wages up to a maximum $200 a day. So this is purely family leave side. If the employee qualifies for this paid family leave, they're eligible for 12 weeks, assuming they haven't previously used their paid family leave or FMLA requirement. So that's depending on how you calculate your leave year. So if it's yearly from January 1 to January 1, it's possible they've already used it last year. If you calculate it with most employers based on the day it's requested, maybe they have, maybe they haven't. So you'd have to look at that. And they increased the cap that they can get under this, and now it raised it from $10,000 to $12,000. So this is paid family paid family leave. So how can you get that potentially 12 weeks of time? So before, it was only if the child's school or daycare was closed. Now they can use it for any of those reasons under paid sick leave. So if you had a COVID long hauler, you had somebody in the hospital, it did happen occasionally where we'd have somebody who was out for a number of weeks or had been hospitalized. This would kick in to provide them with pay. So if they became sick and needed leave beyond that 10-day period, then they could take up an additional 12 weeks of time. So that's going to give them after April 1st. So starting today, they could take a total of 14 weeks of paid family leave if you opt into the paid family leave program. You don't have to, it's an if you want to decision. And you're going to get the tax credits back, right? So it does have a non-discrimination clause. So if you want to take advantage of the tax credit, you cannot discriminate in favor of highly compensated employees. So you can't just say, well, we're going to give this to management folks. Nope, cannot do that. Or we're just going to give this to our full-time workers. Can't do that either. And I know typically we do have other perks and benefits for highly compensated or full-time employees, but this can't be one of them. It also can't be based on tenure. So think of it this way, you can't pick and choose the rules on it. If you're opting in, you're in. Don't pick and choose the rules on it. But we've gotten a little bit of guidance. Can we do one or the other? Can we do paid family leave? Can we do paid sick leave? This is unclear, and I do expect that they'll issue some FAQs on this here very shortly. And of course, if you're a member of California Farm Labor Contractors Association, you know that they're really good about notifying you when new laws and FAQs come about. So keep an eye out for those. If you're one of my clients, you know, we send out emails on it as well. So we'll let you know if something pops up. But it does look to me like you can say, look, I'm going to opt into, and I'd be comfortable with you doing this. I'm going to opt into the paid sick leave, so the 2 weeks, so that I can get my credits back for the California that I have to give. But I'm not going to do this paid family leave program where I'm giving another 12 weeks of time. Once you opt in, you can't change the rules, meaning I can't say, well, I'm going to opt into paid sick leave, but I'm only going to give it for reasons related to the vaccine. Can't do that. It's all the reasons for qualifying for paid sick leave or none. So if you're all in or you're all out in that respect. And you can't change who it should apply to, right? So take a look and keep your eye out for FAQs to follow on that. So layering those laws together in a manner that you can easily kind of come back to and take a look at, you are going to get a copy of the presentation today. I want you to take a look. This is a great one to come back to and look at again. So if you have less than 25 employees, you don't have to do California's supplemental paid sick leave under SB 95, but you can choose to take advantage of the federal program so that you get those employment tax credits for each quarter in an amount equal to 100% of the qualified paid sick leave that you're paying out. So it is going to credit you back. So it's a great way to give your employees some assurance, you know, that they can get the vaccine or they're going to get paid time off. So good. It's a good option to take. You don't have to take it. And remember, you still have the OSHA rules in play here. None of those have changed just because we've been vaccinated. Those are all still in place. So that would help you cover that time off if you had to exclude folks. If you have between 25 and 500 employees, you have to have the California paid sick leave and you're entitled to the federal tax credit. So I would say here at a minimum, opt in to the new American Rescue Plan to get that money back. Take advantage of that. That's a sweet spot for you to be in to get that money paid for. If you're over 500 employees, you have to provide the California paid sick leave. And I'm so sorry, you cannot get the tax credits back. So the employer is bearing 100% of the brunt if they have 500 or more employees. So the qualifying reasons under in addition to the qualifying reasons under SB 95 that I gave you, the California plan, the American Rescue Plan does add employees who are unable to work or telework or awaiting the results of a COVID-19 test for their employer. So that helps us under that OSHA exclusion rules, getting those folks covered. So it adds a little bit there. So if you do opt in, you are going to be providing that one as well. Because remember, I can't pick and choose the rules once I'm in that side. So tax credits. I am by no means a tax expert, so I would suggest that you work closely with your CPA and your tax advisor when it comes to tax stuff. But I can tell you the rescue plan extends 100% tax credit to anyone who volunteers to provide that paid sick leave from April 1st through September 30th. So between those periods, you've got a new amount of paid sick leave to use. And you can do this whether or not you opted in between December 31st and April 1st. So you can make a new decision here if you want to. Those tax credits may be claimed on a quarterly basis. against your share of Medicare taxes. So that is different than what we were doing before I believe it was payroll. And you can claim a refund if the amount of the credit exceeds your taxes due in that calendar. And you're also able to take an advance against that tax credit when making tax deposits. So a few of you could do that. Most of you weren't able to figure out how to do that because your payroll systems automatically pull that out. So what employers are covered under the new California supplemental paid sick leave? Where that's all employers, public or private, with more than 25 employees. And that does include union folks as well. So everybody's under that. Which employees are going to be covered? You have to be unable to work or telework for those very specific reasons provided under the new law. Then they're going to get an additional up to 80 hours of time, and it includes the new reasons for paid sick leave as well. So does the California supplemental paid sick leave apply to independent contractors? No. So unlike the previous law that said, look, if you're basically a joint employer, we're going to hold you both responsible. This one doesn't have that language. But it does say, look, if you've misclassified somebody as a 1099 or independent contractor, you will be on the hook for this supplemental paid sick leave. So drilling down a little bit now on the reasons for taking leave. So is a covered employee eligible for COVID-19 supplemental sick leave if someone with whom the covered employee lives with is exposed to symptoms or diagnosis? So this is just under California. So the short answer is maybe. They have to be recommended to stay home by a medical provider or placed on quarantine or isolation by public health or the CDC or a local health officer, then they would qualify. And we usually help them out there by saying, hey, look, go get an isolation order. Public health is more than willing to give those to folks so that they can get paid, because that's their job. They want to make sure they're slowing the spread. And they're not as busy right now, so it's much easier to get a hold of them. So does being subject to a general stay-at-home order mean you're subject to isolation or quarantine? And the answer is no. So I know there's been discussions about a fourth wave coming. Should we get locked down again? That doesn't trigger this paid sick leave. So they have to be subject to a very specific isolation or stay-at-home order directed towards them. Looking now at the start and end dates. So this is where it got really confusing and we got really worried because it says, gosh, there's retroactivity here. So what period does the California plan cover? It goes January 1st to September 30th. And it officially began where we needed to start paying it March 29th, earlier this week. So anytime now that somebody requests that pay, they're requesting the pay, they've got to be paid on their next regular pay period. So, and if the law expires on September 30th and they're taking the leave, they get to finish it out. So that's a little different than what it said under the federal program. So they can continue taking it under state. So when must an employee begin paying that supplemental paid sick leave? So that's March 29th. They have to begin paying that to people who request it. So they have to request it. We don't have an affirmative obligation to go and hunt them down, but I'll give a little warning to you here. The labor commissioner in California is super employer unfriendly, unfortunately, particularly if you're anywhere near the Sonoma office. And even when the law is super explicit that you do not need to hunt people down, I'll tell you, be careful in that area because they stretch it much farther than they should. It's an appealable issue, but that's not cheap to do, right? So it has to be covered, it has to be paid starting March 29th, and we would pay it retroactively to January 1st. Once the request is made, we have to pay it no later than the payday, the next regular payroll period. So if I'm paying today and the employee requested today, I don't have to pay today because my next regular pay period is going to come up next Thursday, right? If you're a farm labor contractor. So that's when it would need to be paid out. So how does an employee request this leave from an employer? How do we make it available? Immediately upon the oral or written request. You can't make it, it has to be written. No. Oral or written request. And I would say anytime there's a hint of it, I would follow up and ask and be a little proactive about it. And how do we deal with this retroactive thing, right? So this is the part that gives us all anxiety that we don't want to miss because it's going to cover folks up to January 1st. And remember, this is the California portion that's retro to January 1. Under the federal portion, this is where things are going to get and be different. You may or may not be able to include a tax credit between January 1 and April 1st, depending on the reason here. So it could very well be you have to retro pay to January 1 and you can't claim the tax credit because I'm looking at the Ffcra rules instead of the American Rescue rules. So keep that in mind as you're looking at this. So once the employee requests retroactive payment, we're required to pay them, but their request has to be made on or after March 29th, 2021. If they made a request for payment from you before March 29th, it doesn't count. It has to come after. So if they make that request, then we can go ahead and pay them. So for example, if they took 2 hours to get a vaccine in February, they can say starting this week, hey, can I get my 2 hours covered that I went to take a vaccine? Yep, we can pay them that time. After the employee makes the request, then we have until the next regular full pay period to pay that retroactive pay. So we have also at the time, this is super important, at the time you go to pay COVID-19 supplemental paid sick leave, you need to put on that paycheck stub an accurate accounting of how many hours you're paying them and how many they have available. So no matter what I tell you coming up about what needs to be on the paycheck stub, whenever you go to pay it out, you're going to be recalculating and making sure that amount is correct. So there's some stuff coming up about variable that's really weird. Go ahead and make an accurate assessment at the time that it's paid and make sure that paycheck stub shows what they're using, what you're paying out. You're going to have a very clear line on the paycheck stub that you're paying COVID-19 supplemental paid sick leave. Doesn't have magic language, but you need enough information there for them to easily identify it's being paid under this new law. So no guesswork into it. So I like COVID-19 sick pay or 2021 COVID-19, PSL, something that you can tell it is this pay quite clearly, because otherwise they'll sue and ask questions later. And I don't like having to explain that. You can avoid the lawsuit altogether if you make it very clear. So make sure you're calculating it on the day you go to pay it out. So you've got an accurate itemized assessment on their pay stub. If you can't fit it on the pay stub, please do a paycheck stuffer that puts it in there until you can. I know some of the companies have already been saying they were not going to be able to meet this deadline. And so I'm imploring my clients, please do a paycheck stuffer. This is a pay stub issue. That could be a PAGA issue, the Private Attorney General Act, where only one employee who works for you one day can turn around and sue you for these inaccurate pay stubs for everybody who's worked for you for a year. So arbitration agreements won't stop it. So make sure that pay stub is 100% accurate with regard to the paid sick leave. So in the absence of any information that a covered employee is not requesting supplemental paid sick leave, can an employer require certification from a healthcare provider before allowing that leave? And of course, the answer in California is no. So you cannot condition paying that leave based on information from a medical provider. You just have to pay it. The only time you can ask for more information is when you have a very articulable reason that you can point to say, you know what, I don't think they're taking the leave for a proper purpose. And the example they give is somebody requests leave for quarantine and then they're seen out at a local park. Well, being at a park is not following quarantine. Then you can reasonably request documentation, but tread lightly there and work with your attorney if you get into that spot, because gosh, there's all kinds of case law out there that they could look to where it, reasonable appearances are like, hey, they're not following their leave requirements. I'm going to terminate them or whatever it is. I'm not going to pay them. Be really careful there because we lose more often than we win on that one. Calculating the leave itself. So this is an important part. So if you are a full-time employee or you were scheduled to work an average of 40 hours for the 2 weeks before leave was taken. So maybe you were considered a variable employee, but you were scheduled 40 hours for the 2 weeks before the leave was actually taken, you get 80 hours. So this is a weird sort of nuance in the rule. And this is why software companies are going to have a heck of a time trying to automate the paid sick leave that's available, because they put in these sort of ridiculous rules that make it so hard to calculate and remember, gosh, is this person available for 80 hours or not? And so that's why I say, if you're, when in doubt, pay the 80 hours, but here it is required. So how do you calculate the leave entitlement for a part-time employee who does not have a set schedule? So if they're considered full-time, remember, they worked full 80 hours preceding 2 weeks, just put them in as 80. But if you've got a truly part-time variable schedule employee who's worked with you for a period of more than 14 days, you're first going to look back over 6 months and you're going to say, okay, how many days were there in that 6-month period? So here you can see in the example on the right, it's 182 days. They worked 520 hours. You divide 520 by 182 and you come up with 2.857 hours, and you multiply that by 14, that gives you 40 hours. So essentially they're half time. So if they normally are scheduled to work 60 hours a week, you're just going to pay them a total of 80 hours of time. If they have been, and here's a really nuanced one, if they've worked for you for less than 2 weeks, then you're just looking at the number of hours they've worked over the next 2 weeks. And I think that might be the next question on here. Yeah, if you worked for the employer for 14 or fewer days, what do you get? So you look back over 14 days and say, how many days did they work? They get 100% of that time. So if they work for you for 7 hours, in the last 14 days, they get 7 hours. So it's at least that one's an easy math problem, right? So if they're truly a variable schedule employee, then you just looked at what they've actually worked for you over the last 14 days. So some of you I know are going to want to know about credits because you've already been paying some of this time out. So how do you get credits back, and can you get credits back? So if an employer makes a retroactive payment on or after March 29th, then can you receive a credit towards that total leave requirement? And basically, yes. So if you make a retro payment, go ahead and deduct that out of their 80 hours or whatever it is they're entitled to, and that's going to count towards your 80-hour max. But remember, you got to then look to and say, okay, is this a qualifying reason that I can get tax credit back or not? And the answer might be different there. So the leave was taken by the covered employee for one of the qualifying reasons. You can retro it, but it has to be a qualifying reason. and then you paid them that under the supplemental paid sick leave, you're going to get a credit back for that. If an employer voluntarily pays a supplemental benefit for leave that was taken before the 2021 COVID paid sick leave law became effective, then can you receive a credit towards the entitlement? Yes. But here's the thing. So you have to make sure the employee wasn't required to use some other type of paid time off. So in other words, if they use their California paid sick leave, if they use their PTO, you would essentially have to repay those banks, and then you could take it under the California COVID paid sick leave. It has to be for one of the qualifying reasons, and you have to pay at a rate that was equal to or greater than the requirements in the COVID supplemental paid sick leave. If you paid it at a lesser rate, because if you paid it under California paid sick leave, it's entirely possible you underpaid by maybe pennies or dollars. You just have to then level up that amount, and then you could deduct it from their COVID-19 supplemental paid sick leave. And remember, when you go to pay that, you're putting on the paycheck stub, the amount they've taken and what they have available for them to use. If some of you have heard me talk about wage and hour compliance, you know, I always say, don't let an employee leave you being owed a penny, not one penny. And this is one of those instances where you're going to have to go and calculate it out and say, okay, based on the higher of 90 days or the regular rate for the last pay period or the pay period they're in, am I paying it at the highest rate, or did I pay it at the highest of those rates? And that may be a different answer. Because under California paid sick leave, I can pick one or the other as long as I do it consistently. That's not the case under COVID-19 supplemental. I have to pay the highest. So you could owe a little bit of money there. So can an employer count the COVID-19 related supplemental sick leave towards a local ordinance that you had to pay it under? And the answer there is yes, you can. So if you were following a local ordinance and there were a number of them in fact that kicked in because the feds and the state didn't do anything about it for a while, then and it met all the obligations under California paid sick leave, the COVID-19, then you can go ahead and credit yourself back or pay the difference, and then you're going to get the credit for that. So you can make it essentially meet both by going, okay, what's most in favor of the employee, what provides them with the most pay, and then you're going to get a credit for that. So if a local law requires COVID-19 supplemental paid sick leave to be paid at a different rate from California, what rate do you follow? Whichever one is more advantageous and higher for the employee. So you have to figure out which one is going to give them the most money, and that's what they get. So go with the higher of those two. So as always in California, there are record keeping and pay stub requirements. So should COVID-19 supplemental paid sick leave be listed separately from paid sick leave on the itemized pay stub or separate writing paid at the time, given at the time wages are paid? Yes. So you're going to have a line for California paid sick leave, and you're going to have a line for COVID-19 supplemental paid sick leave. If you remember before, food and ag was exempted out of that paycheck requirement. It is not exempted here. It is not exempted here. So this week, some of you are running payroll today, you've got to have a line on your paycheck stub for couples COVID-19 supplemental paid sick leave. So get that on there. It is a huge, huge liability if you don't. Do a paycheck stuffer if you can't get it on there, but please do your best to get that out. So how should an employer calculate and list the COVID-19 on the paycheck stub for variable scheduled employees? This is like super fun. So essentially, if you're truly variable part-time, then you're going to put on the pay stub variable, and you're going to calculate it based on the day for this week, essentially. So if you go to pay this week, we're going to put variable, calculate it for today, put it on there, and that is sufficient. And then when you go to pay it out next, you're going to have to change that to be accurate, right? You don't have an ongoing obligation to update it each and every week. If you're a farm labor contractor and you're paying weekly, or if you're paying twice a month, whatever it is, you don't have to recalculate it each time. So that is kind of a weird nuance. You can, but you're not required to recalculate it until you go to pay it again, and then you'd recalculate it and provide it accurately, which is one of those weird nuancy rules. So of course, there's going to be enforcement in California. So we have to provide employees with notice by putting this poster up in a conspicuous place, or emailing it to them or disseminating it to employees, so that they get it. We don't have to have them sign off on anything. We don't have to have a separate policy. The notice itself is quite sufficient. So if an employee feels like they're not getting the appropriate amount of leave, or if they didn't get notice, they can go running down to the labor commissioner's office and they'll come after you for it. So, and they can come after you for just that employee or for everybody. So watch out for that one. What rights does the covered employee have if they suffer retaliation, like getting fired if they ask for that paid sick leave? There is a no retaliation clause in there. The labor commissioner's office can investigate it. They could bring a private civil case, and they can even investigate you just for not providing notice. So make sure you get your posters up. Otherwise, you could be facing one of those cases. So overlaying these laws together, right, can an employer require that an employee use COVID-19 supplemental paid sick leave when we exclude them under OSHA's rules? Yes, we can require that they use that particular pay. We can designate that and say, look, we've had to exclude you under OSHA's rules. We're going to pay you under this. We're not asking them in this situation. We're just telling them this is what they're going to use. So they can't strategically hold that back. When we did talk about the OSHA rules before, we said, well, you know, there's a possibility they could get state disability insurance benefits and things. Here, we cannot use SDI to supplement the California paid sick leave. It may be that once that's used up, they can go and apply for SDI, but they can't before. We have to give it to them before that. One of the big questions I'm getting, so I went ahead and threw it in here, is once an employee is vaccinated, must you still follow OSHA's emergency temporary standards? Yes, you still have to socially distance. You still have to wear a mask. I'm hoping OSHA catches up with this rather quickly. We've been required as employers to pivot. They need to pivot now, right? Now that we've had opportunities to be vaccinated for food and ag workers. One thing I wanted to throw in here, and I'm by no means a COBRA expert, but I wanted to make you aware of this because it does carry some significant penalties, and I'm going to want you to work with your benefits brokers on this, and hopefully they're providing you with information, or they're going to be getting this out to you very quickly. Is the American Rescue Plan requires employers to fully subsidize COBRA for 6 months. So the American Rescue Plan that went into effect today requires employers to fully subsidize COBRA for 6 months. So this is for employees, their spouses, and dependents who lost coverage in November 2019 or later due to their involuntary termination other than for gross misconduct. That's a big one. So did you document why they were terminated? Or a reduction in hours. So due to their involuntary termination or a reduction in hours, if that triggered COBRA, you're going to have to follow some notice requirements, and they get a second bite at the apple to get 6 months of COBRA coverage. There's no subsidy required for employees who voluntarily terminate their employment or who became eligible for Medicare or another group health insurance plan. So if they were a no-call, no-show, did you put in your notice, no-call, no-show? Your notice of change in relationship form. That's when that form becomes super important for us to say they were a voluntary termination. We did not terminate them. So that's one more reason I love it when you use that form to document how an employee leaves your employment. So Employers must notify eligible employees about the new COBRA subsidy by May 31st. Model notices are expected to be out by mid-April, and I'm sure your benefits brokers are going to have those for you. Eligible employees who did not previously elect COBRA and stop, or elected but then stopped paying their premiums, have to be given a second bite at the apple to participate. If they elect, their coverage begins April 1, today, right? The period when employers are required to subsidize is from April 1 to September 30th, and it's for a total of 6 months. So that's obviously more than 6 months, right? No, maybe not. I don't know. Not good in math. The subsidy period does not lengthen or shorten the required COBRA period. So that's not going to change. So if they've already burned through their COBRA, it's not going to give them more COBRA time. So there are 3 notice requirements that are going to be out there. Notice of a subsidy termination. So if it's going to terminate out, you have to let them know between 45 and 15 days beforehand that it's going to terminate out. If they're new qualified beneficiaries, you got to let them know of that. They're going to issue that model notice by April 10th. That can be used, and you have to provide it by May 30th. And if they had previously been out, right, we have to give them that special notice opportunity by May 31st. And they get a 60-day election period. So the idea is give them notice as soon as you can so we can run that 60-day period. So that 60 days doesn't start till we give them notice of that. Now, the good news is, last piece of good news before I dive into the Q&A, is there are tax credits available for this. So again, it's going to go to Medicare tax liability. That credit's going to be refundable and is advanceable. So just like under the paid sick leave. So it could be you end up with more out there than, or more owed back to you than what you actually owe. And so you can still get that back. So with that, let me move on to the Q&A portion to get you guys all answered here.
Thank you so much, Erica. That was a lot, and we have a lot of questions. So we're going to try to go through these pretty quickly. So there's a lot of questions asking about when this kicks in. Can you clarify, as it looks like the bill language states more than 25 employees? So does this kick in when you've got 26 employees, or is it right at 25?
So it is for, and you'll have it on your notice, 25, more than 25. So if you have 26 employees is when it kicks in. 26 employees, it kicks in. You got to love the variations on this in different laws, right? Just to make it complicated. So when you have 26 employees, it's going to kick in for you.
So if you have fewer than that, you don't need to have that required posting, don't need to share it out. Is there anything that small employers should take into consideration?
Yeah, if you're a small employer, you may want to just take advantage of the American Rescue Plan's tax credit to encourage employees to get vaccinated so that they're not worried about taking time off. And because OSHA exclusion rules still apply to you potentially, right? So if somebody in the office gets sick, that is going to have people being excluded and you having to pay them. You might as well opt into the federal program and get that all covered. So if it were me, that's what I would do, but you got to make that decision yourself.
Okay. And then how do you calculate the number of employees? For example, if prior to March 29th, you had fewer than 25, but now you're over that 26, what are they looking for?
We don't know. Good question, right? I believe it's going to be looked at the time leave needs to be taken. So if you're ramping up your number of employees and you hit 26, I'd get that notice out and I'd start offering it and get it on the Paycheck Stub. Keep your eye out for FAQs on that to be added. It is not in the FAQs as of 2 days ago. I think I checked. I didn't check today. To see if to give us more information on how to calculate our 26 employees. But typically you're going to be looking at the time leave was taken, how many employees did I have? Sort of like it's a work week by work week view, sort of like you do for minimum wage.
Okay. Next up, we've got some questions getting into how they're defining hours for employees. So when you're discussing the full-time versus part-time, how are they treating seasonal employees? Are they getting these full 80 hours as well?
They are most of the time, because if you look at the 2 previous weeks, if they worked 80 hours, they're automatically in as 80 hours. If there's an expectation that I seasonally work, 8.5 hours a day or 8 hours a day, they're full time, they're going to get their 80 hours. So even though I wouldn't consider them variable scheduled just because they're seasonal.
Okay. And then what about piece rate employees? Are they falling under this 90-day look back since their daily hours and pay rate changes every day?
Oh yeah, they do. And that's going to be a nightmare calculation for us because we can't pick between the two.
Maybe not the answer everybody was hoping for.
Yeah, no, right? No, it's a literal nightmare on calculation of pay.
All right, this regular rate of pay for their work week in which leave is taken, this just means the average rate for that whole week.
Yep, exactly. Your weighted average, just like you would do to calculate overtime. So I take all their different rates of pay, I dump it into a bucket, divide that by 45 if I'm an ag, wage order 14, 40 if I'm not, and that will give me my regular rate.
Okay. So we've got quite a few questions asking about what kind of documentation can you require as proof that an employee was either asked to isolate by a doctor or the health department, or proof that they actually had a reaction to a vaccine. Can they require a doctor's note? How do you know that they didn't just decide this themselves? Is there anything that you can require from your employees for this?
Nope. So this is highly subject to fraud. And we saw a ton of it before. We had employees who were subject to quarantine like every 2 weeks. And they thought they were going to get, once they burn up their 80 hours this time, they're not going to get it again, again. But totally subject to fraud unless we've got very specific proof that we can point to say there's fraud going on there. We can't ask for anything. It has to be paid upon the oral or written request.
So if an employee doesn't actually go to their doctor, but they do go get a COVID test on their own, does that qualify under this as seeking medical diagnosis?
Probably. I would say, yeah, I would give it to them for that, because they're going to get a diagnosis with their test, even though it's not from their doctor or maybe specifically a medical facility. The other thing you can do to discourage fraud is I always tell people, get public health involved. If somebody's saying they are sick or they've been exposed, I would let public health know because they'll do their own investigation. And that tends to make people who are faking it a little nervous.
Okay. Moving back here, we have a question from one of our Spanish listeners. Mm-hmm. So when it says you have to pay them time for vaccination, is that literally when they're sitting there waiting in the office?
Yeah. So I would say travel time, time in the office, how they have you wait 15 minutes afterwards, that travel back, I would cover all of that time. And if you made it mandatory, make sure you're paying mileage too. Now, mileage won't be reimbursable under these programs, but the time that you're spending for their vaccination will be, and that's an average of 2 hours. Maybe if you're more remote, it might be up to 4.
All right, we've got a lot of questions about really how to apply these hours. So if an employee already used those 80 hours they were eligible for last year, they have to give this to them again. And then how would they separate that on the pay stub from the previous 80 hours?
Yeah, so the previous 80 hours for ag workers didn't need to be on the pay stub. This is going to be a brand new line, brand new designation, 80 hours plugged in, they'll get it again.
Okay. If we choose to apply the Ffcra credit instead of the California requirement, do we still have to have a balance line on their pay stub?
Yeah, because the California is mandatory, the Ffcra is not. And so you've got to meet the highest standard there, which is having it on your pay stub. Good question.
And then is this additional time, is this a one-time use only? Say an employee used 1 day of that paid leave to get vaccinated. What happens with the other 9 days?
It's not a one time. And so if they, let's say they use, okay, first vaccine, I used 4 hours, second vaccine, shoot, I'm sick for 3 days, get a bad reaction, they're going to get that initial 4 hours plus their additional 3 days would be covered. So it's up to 8 hours, and then you're going to leave that balance on there that they, hopefully won't need after that.
Okay. And all these questions about pay stubs, do they need this on for tomorrow's checks? They have to have that balance line. There was some question if it starts 10 days from when it became law.
So the 10-day mark was March 29th. So it got signed on the 19th of March, and the 29th was the 10-day period. And so if you're issuing checks this week, you need it on there. So if you're a farm labor contractor, that was yesterday or today. If you're a regular grower, it could be tomorrow or Saturday, right? Then you've got to have that on there. If for some reason you screwed it up, you couldn't run a separate sheet and keep a copy of that so that we can prove we gave it to them. I would say fix it before anybody notices.
All right. And do they need to have 2 lines, one with the available hours and one with the used hours?
No, all that's required to be on there is when you go to pay it, you're going to have a line for paying it. And then let's say you're not paying it all this week, you're just going to have what's available. A really good question.
All right. What if they had an employee that did miss time for qualified reasons, but are no longer working for them anymore? How would they still be required to cover that?
If they come back and ask you, yes.
Okay. If an employee was vaccinated between January and March of this year and had a reaction, can they use the federal pay retroactively for the first quarter of this year?
No, sorry, no. And that really hit all of us. We did such a great job in food and ag and getting our workers out and vaccinated. So unfortunately, all of us that were right on top of it and got all this done, we don't get that benefit. So sorry.
Okay. Just wading through some questions here. We've got a lot. So to be entitled for this full 80 hours, an employee has to have worked at least 80 hours for the employer. And then if the employee requests the leave before they've worked those full 80 hours, are they entitled to just an hour that they've worked? How does that work?
So it depends. If you hired them as a full-time employee, they get 80 hours on day one. If you hired them with no expectation for a particular amount of hours, and I would say be careful here, if it's truly no expectation of full-time work, then you would pay strictly the amount that they had worked for you in the last 2 weeks.
Okay. Just wading through some more here. I know we're going over time, but you guys have a lot of really great questions. Okay, here's an interesting one that probably doesn't cater to a lot of them, but if you have an employee who lives in a different state, but does work for a California employer, are they eligible for the supplemental paid leave?
So they shouldn't. I'm not entirely. I know, right? You stumped me. Let me put it this way: if you've got folks who are working in Arizona, no, and even though you're based out of California, no. because we get a lot of that. But if you've got somebody who's remotely working from a different state, but their work is considered to be taking place in California, then yes, they may be, but I'm not entirely certain there. So I know it's super important that you get their accurate address on their paycheck stub with their out-of-state address, because their tax situation is going to change. But if the work is considered to be taking place here in California, they're likely going to be getting the California laws. But if you're just based in California, but they're physically working, like, we do a lot of, we'll switch back and forth between Yuma and the Central Coast. When they're in Yuma, they're going to get whatever applies in Yuma, not what's in California. But when they come back to California, California stuff is going to kick in immediately.
Okay. If an employer is not requiring the vaccine, do they have to pay travel time and do they have to pay mileage?
No.
Okay, that's a good one. Does this apply to people who are exposed outside of work, or is this only for potentially exposed at work?
Doesn't matter either.
Ooh, here's a question about bonuses. If an employee makes minimum wage and got a harvest bonus based on their production, would we need to pay the average of those 90 days prior?
Yes. I'm going to say yes, because we don't have an FAQ on that yet. And we do put non-discretionary bonuses into our regular rate calculation. Until they clarify that, I would put it in there. There's an odd case out there that says, like, for a meal period premium, we wouldn't put that in there. But this could be, and I would say, because it's going to be mostly enforced by the Labor Commissioner's office, they will come down and say, nope, it bumps the rate up. You had to include it. So you're better off calculating it over until we hear otherwise. Now, if it's a discretionary bonus, hey, you know what? You guys did an awesome job this week. Here's an extra $100 a person. That wouldn't get calculated in. But if it is, hey, you completed the season, I'm giving you an extra $100. You do X, you get Y, put it into your rate. If that applied during the 90 days.
So an employee has to request this.
Yeah.
But do you have to put it on the pay stub before the employee requests it, or can you wait to put on the pay stub until they ask?
Nope. You have to have it on there starting this week. So any paychecks issued after this past Tuesday, so the 29th of March, must have it on the paycheck stub, whether they ask for it or not. And if you don't, it's a PAGA violation, Private Attorney General Act, and the Labor Commissioner can fine you per paycheck that doesn't have it. Good time.
All right, a couple more specifics here. Our employees were vaccinated on March 19th of this year. Are they eligible to take this time for their COVID vaccine?
You can choose to retro pay them for that amount. So you can choose, or they can ask, either one, but you're not going to get the federal tax credit on it.
Looks like some questions about how they want this on the pay stub. This particular one, their payroll software shows it under other hours available. And then at the top, the pay stub includes the statement, other hours available includes COVID hours. Does that qualify, or they need to be more specific?
Yeah, I don't like that one at all. I would ask them to label it COVID-19 supplemental paid sick leave or something closer to that. That to me is too vague. The Labor Commissioner's office is very specific that they have to be able to look at their paycheck stub and determine that they have COVID-19 supplemental paid sick leave hours available. And I don't think that does it.
All right. This one's kind of specific throughout some of the counties in California, since I've been handling it differently. Some of the counties amended EPSL through March 31st. Does this mean that the employees who used it get an additional 80 hours from this new one?
Not if you go back through that retroactive calculation and you choose to say, look, I'm going to retroactively deduct it from the 80 hours because I met it. Just make sure you paid every ounce that they would get under the California paid sick leave. And then you can choose to deduct it off that 80 hours, but make sure you're paying the highest of those rates, and that they were given an opportunity to take 80 hours of time. So if they're full-time.
Here's an interesting one. We already went over that an employer cannot request proof from an employee for any of this time, but they ask, we as employers do have to have proof to get these credits. What proof do we have to have?
Oh my gosh, fantastic question. I'm so glad you asked it, and I meant to bring this up. So remember before under Ffcra, we had that documentation you could fill out, and California Farm Labor Contractors has it on their Kovid page. Use that and just add in the additional reasons. So I'm filling it out, I'm putting their name, I'm putting the time that they go to take, I'm checking the box for one of the reasons taken. That's all you've got to have. And you sign it. If they're available, they sign it, or you say not available to sign. That's your documentation. And you definitely want to have that in place should you get audited by the IRS for taking that tax deduction. Or if California says, hey, look, you didn't pay this, or, did you do this correctly? You've got proof of that. That's your proof, even though you're creating it and you're not documenting it by putting anything with it. So that's sufficient. Great question.
All right. It looks like we could go through for another hour just on the Q&A.
I know.
So I'm going to cut this off. We're going to take two more. One is if an employee of their own volition goes to get the vaccine themselves, nothing on the employer side, can that employee come to the employer and request this time for getting the vaccine on their own?
If it was during non-working hours, probably not. If it was during working hours and they missed time from work, I think they can.
All right. All right. Last one, just because you added the COBRA on the end here.
Yeah.
For COBRA, who gives the employee notice, the insurance company or the employer?
So you'll have to talk to your benefits provider to ensure that because it's your responsibility as the employer. But if your carrier is doing it, then that gets you off the hook. But you have an obligation to check in with them to make sure that they're doing that. So talk with your benefits provider on that to ensure one of you is sending that out.
Okay, I lied. We're going to go to 11:15 if we can steal a couple more minutes for you. If an employee is sent home due to being exposed to someone at work and the employee chooses not to seek a medical diagnosis, but still quarantines at home, does that employee qualify for these benefits?
They do not qualify for the benefits under California, but they do under the federal program, under the new rules. So you could pay it under federal, but not under, they wouldn't be deducting under the state 80-hour portion. And remember, you can't go beyond 80 hours, but this might be one where you involve public health, get them quarantined, and then you could. These are out.
So this last one, we had several questions asking about that required poster and how people could distribute that. You mentioned email. What if they have people who are out in the field, they don't have a standard place to, post in the break room or whatnot? Mm-hmm. Can they mail this out to the people? Where would you recommend they post these, and how to get that information out that's required?
Yeah, and I know one of the questions was great because it said, can we put this in as a paycheck stuffer? You can, absolutely. You can put it in, and I would just stick it in with their paycheck stub. That's sufficient. Yeah, posting it up by the bathrooms, on the bathroom door, that's sufficient as well. Oh, I don't have the poster in Spanish yet. Good question. I would assume they're going to come up with it in Spanish. So stay tuned for that. But when I checked, I just saw English so far. So that usually takes them a couple extra days.
Okay, great. Well, thank you so much for sticking with us this little extra time we went over. It's a lot. So as everybody can see.
Oh, somebody confirmed poster is available online for Spanish. So thank you. So if it is available in Spanish, you should be distributing it in Spanish to your Spanish-speaking workers.
Fantastic. We'll definitely be sure here at CFLCA to send that out in our newsletter on Monday. So check that. And we'll also send out the copy of this recording and presentation. So check your emails. As you can see here, Erica's sharing her contact information. So I know there's a lot more questions that we don't have time to get to. So feel free to reach out. Thank you so much to our sponsors today, the UC Davis Western Center for Agricultural Health and Safety, for bringing this excellent resource to everyone. Thank you to Erica, our amazing presenter, as always.
Welcome.
And thank you to Lourdes, our interpreter today. So thanks so much, everybody, for sticking with us, and we'll see you next time. Stay safe.
Thank you.